I was contacted by an Irish GP trainee. She put this up on social media, and I think I was tagged in or whatever, but 24 hours later I'm finally finished my shift, absolutely shattered. Time to get a coffee before I drive home. Sadly, many doctors have lost their lives driving home from work following these dangerous shifts. Would you want an exhausted doctor managing your loved one in an emergency on the ward? Would it not make more sense to reduce the hours we work per shift? I suppose added to that personal danger that was highlighted by that trainee, there's also, I suppose, an increased danger of slippage in PPE, that you mightn't use your PPE properly, etc. So we do have this ongoing crisis with our healthcare system and inadequate human resources, which presumably are caused by inadequate monetary resourcing.
I'm at 40 years and I'm ashamed that we still have the problem that I faced 40 years ago, still today. Changed dramatically, very, very much so. We are committed, and we will, and Anne-Marie will come in a bit more on this, very much committed to making sure people work many less hours than they often do. But like I say, some of our difficulty is that equally the commitment of people to do the work. It is a difficulty that we've got to get across, how we try and rectify those things. But Anne-Marie.
So I can't comment on the individual case that you referenced, Deputy, but it's certainly not something that we would encourage or condone in the interest of the safety of staff and indeed the patients that they're managing. We do indeed rely on the senior clinicians to manage such situations to ensure that those long hours don't occur. We also have the European Working Time Directive that we're obliged to adhere to. In terms of an increase in our medical staffing, we can see that we have indeed increased our medical staffing significantly in recent months, and in the year to the end of June we can see that we have increased our medical staffing by over 1,100 doctors into the system.